This now I can't change. So if I want to affect the pressure, what do I want to change? The surface tension. And do I want to change the surface tension everywhere or just in some places? I only want to change it down here, right? Because what do I want the pressure to do? I want to do something to lower the pressure in small alveoli so that the pressure gradient now will be high pressure to low pressure. You okay with that? So here's what we do. We take these small alveoli and we put in these small alveoli a lot of these type 2 alveolar cells. So I'm going to put them on here with orange, right? So here we're putting type 2 alveolar cells in orange like this. And where do we have more of them? Have more of them in small alveoli. Right? So in the small alveoli, I have a lot of type 2 alveolar cells. In the large alveoli, I don't have any or very few. What do they produce? They produce surfactant. So all of these cells right here are going to make surfactant. Now, surfactant is, I can't remember the name of it, but it's a lipoprotein. It's got a combination of a lipid and a protein. But what it does is it interferes with the hydrogen bonds of the water here, so it makes them weaker. So because it makes these hydrogen bonds weaker down here, that is going to decrease the surface tension down here. And if you decrease the surface tension down here, you decrease the pressure. So now, because of these surfactant cells, now we have what? A low pressure here and a high pressure here, right? And now where does air want to move? At rest, in there, and what are we going to do? We're going to have inflated alveoli. Okay. You all right with that, Joe? Now, when there is a split second between being a fetus and a newborn, and that's called childbirth. Okay. And it lasts a little bit longer than a second. While a fetus, where is the blood being oxygenated? Well, mom's in labor, ow, 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 we've heard it all before, right? But the blood in the fetus is being oxygenated still in the placenta, not in the lung. In fact, that's true until they do what?
Cut the cord.
Cut the cord. Right? So is fetus, even if it's split second away from being born, using its lungs for ventilation? No. So does it care about the French? Does that matter? Does that whole story we just told matter? It doesn't matter. None of it matters. Right? But the second it's born, it now matters. Because now we have to use the lungs for ventilation, and we better make sure that they will inflate upon birth, okay, because of surface tension being low in the small alveoli, allowing for alveolar filling, and then that negative pressure in the pleural space to allow for total lung, to prevent total lung collapse. Does that make sense? So surfactant is expensive to produce. So it takes energy to make surfactant, just like it does to make anything. So why would a fetus make it if it doesn't need it? It doesn't. But it should start making it just prior to childbirth, right? So that when it is born, boom, it's got surfactant, the surface tension's low, lungs will inflate, and there'll be no problem with ventilation. And surfactant production starts at about 36 weeks gestation. So the last month, if you have a 9-month gestation, right, it's a 40-week gestation time from the date of the last menstrual cycle, right? It's 40 weeks, that's gestation. That last 4 weeks, most fetuses will begin producing surfactant so that when they're born, the lungs work fine. Now, where is there a problem? Well, there's a problem